Oral health is a key indicator of your overall health and that of your child. Children who have poor oral health usually have problems with their communication, eating, playing, among other issues. Tooth decay or dental cavities are one of the most common infections in children. The good news is oral disease are largely preventable, and keeping the children's teeth healthy should be a goal of every parent. Tonight on Health Check, you will be learning more on healthy habits you can establish with your child that will help boost your child's oral health. We have in studio Ruth Gasheru Mungai, a dental specialist, live in studio to take us through the topic dental health and hygiene in children. Please start sending in your questions you have regarding today's topic. Our SMS line is 22232. Good evening and welcome to Health Check. My name is Grace Mutiso, as always, an honor and as joy to serve you. Allow me at this point to invite Ruth. Good evening, Ruth.
Good evening.
How are
Grace.
you doing?
I'm fine.
You know, the first thing that struck me when you walked in here is your dental formula.
The smile.
The smile.
I am an advocate of healthy, beautiful, and long-lasting smile.
Yes.
Yes.
It's something you purposed. This
Yes.
one is a must.
Oh, it is a must.
And
I do
it's
that.
achievable.
And it's passion.
Yes.
And it's career.
Yes.
So it's where career meets passion. And I love it because we help people to understand and to know what to do with their oral health.
Yes. Karibu sana.
Asante.
So let's start by defining what is dental and oral health, especially in regards to children.
Okay. Dental, when we talk about dental, I know most of the people think about teeth.
Yes.
But amazingly, dental is teeth, gum, cheeks, lips, everything that includes in the mouth or is all inclusive in the mouth. But majorly is all about teeth. So the components that make the dental components, number one is teeth, which we have different types of teeth in the mouth. In children, we have 20 teeth. I always say, imagine God, how he was so careful while creating teeth, because he created 32 teeth, and each teeth has a function.
Yeah.
Amazing.
Yeah.
Amazing. The detail in that, you know, when you are a doctor who deals with teeth and you get to the teeth, you will see that every tooth has a different shape and different function. That's amazing, isn't it?
Yes, it is.
And I think one thing that I keep telling people is, because it was so detailed and each teeth has its own function, you need to take care of them. Yes, of your teeth, because if you disrupt the creation of God, you disrupt the function. So basically, dental, that is the mouth, the tongue, and the gums. Yes.
You know, you mentioned the cheeks, and I'm like, wow, it's also part of that.
Yes.
How come? I never thought of I never thought of that.
Yes.
How is it important when it comes to the cheeks? At least the lips we know, the mouth we know,
Yes.
the tongue we know.
Yes.
The cheeks.
You see, if you don't take care, for example, of your jaws,
Yeah.
and you extract some teeth, yeah?
Yes.
You see the way you look good? Just extract 5 teeth. You know your jaw will collapse and the cheeks will sag. So the teeth helps in maintaining the physique of the cheeks, the way the cheeks look like.
Yes.
Yes.
So they are really
They are all connected, imagine.
Okay.
Yes.
God is amazing. And what's the link between children's oral health and their general well-being?
You see, if we come to talk about teeth, number one, the function of teeth. The one people know, and the basic one is eating.
Yes.
Yeah. So if the children's teeth are not intact, or that child has diseases, maybe talk about cavity, what will happen? They will not be able to eat well.
Yes.
So that affects their nutrition. And they may end up getting diseases that affects their nutrition or malnutrition, something like that. So they may not be able to eat well. So that's number one. Number two, teeth gives you good confidence, because the other function of the teeth is speech, gives you good confidence. So if your teeth are not in good shape, for example, a child has teeth that maybe are not aligned. that really takes their confidence down. They have this low esteem. I don't know whether, Grace, you've ever seen a child or anyone, not even a child, even an adult, and when they are speaking, they just cover their mouth.
Yes, or they look
Yes,
down.
or
they
they
don't
look
that
down.
eye-to-eye contact. Yeah.
It's because their teeth are not intact. And you realize when you look at yourself in the mirror, the first thing you see is the teeth.
Yeah.
So this connect a lot. So if they are not intact, you realize they will erode a child's confidence or esteem. Yes.
Okay.
Yeah.
And you were mentioning a child. That means there is something that a parent needs to do when this child are really tiny or
Yes.
small,
Yes.
so as to help them have healthy teeth. What are
Yes.
some of these things that a parent needs to do or a guardian?
The things that a guardian needs to do is, one, we need to know when the teeth are supposed to come out, especially for a toddler, because if they don't come out the right time, that's where now we get what we call malalignment or malocclusion. So this is what causes now teeth, some are in, some are out, because the teeth were not removed in the right time. So that's something that parents need to check. And you know, we are in this busy era. So sometimes we are not even in terms or in view of what our children are doing concerning their teeth. So by the time you're realizing, other teeth have grown above others, you know. So it's good to know. And if we can talk about it, at around 6 months, that's when the first tooth of a child is supposed to come in the mouth.
The upper one or the lower one?
The lower one.
Okay.
The two central incisors, the lower ones.
Yes.
But I don't know, it's a generation where we are. I think things are rushing. Sometimes you can get even 4 months. Like I think my children, teeth came in the mouth at 4 months, you get.
Wow.
So 4 months, we can say 4 months to 7, those who delay, or even others 8, especially boys delay, you can get that their teeth have not yet erupted. That's the milk teeth I'm talking about.
Yes.
So at 7, they go increasing, so they get from the central incisors, they go to the upper ones, the central incisors, they go to the lateral incisors, just like that, adding until we get 20 teeth in a child. Now, what happens is that at around 6 years is when now the first tooth is supposed to fall off. And now we get the permanent tooth.
At 6 years?
Yes, at 6 years. So sometimes you can see other comes early and other delay.
Yes.
So just depending with the mileage of the child and the milestone the child is taking. Some go with the time, others delay, depending. So at 6 months, the first tooth now goes off and the other one sets in. So if you delay and that tooth shakes and you didn't shook it the right way or the right time, what happens? Another one sets in.
That is at 6 years.
Yes.
So you delay, you don't remove it,
Yes.
another one grows.
Yes.
So what's the danger of that?
What happens in that is that when you don't remove them, now they get malaligned. So you get others are growing while others are still in the mouth. And when we don't remove the right time, the ones that are supposed to go, because of that space is limited, so you get maybe they are growing in the wrong places where they are not supposed to grow.
Yeah.
And when that happens, you realize as the child grows, because those teeth are still in the mouth and maybe they are not in the right places, so as the child grows, when they become maybe of teenage, this starts affecting them.
Yeah.
Yes.
There is steam. I remember we talked about this steam.
Yes.
Okay.
Yes.
So one of the things that parents are really worried about their children when it comes to their dental health and hygiene is bad breath.
Yes.
So when a toddler or a baby has bad breath, what is happening in their mouth at that time, and what can be done to sort that?
Yes. What's happening in bad breath is like, one, their hygiene is wanting. Yes, their hygiene is wanting, and this is a good thing to talk about.
Yes.
When we talk about hygiene in children, for me, I don't fault the child. I fault the parent. And as I said in the beginning, we are very busy parents. And, in the society we live in, it's true, we are busy. And so we are not taking care of our children's teeth how they should be taken care of. And it's from the beginning. Most of the parents ask me, when should I brush my child's teeth? That's a good question, and a common question people always ask.
Yes.
And you should do that at 6 months.
6 months?
Yes. Immediately, the first teeth sets in the mouth.
So even how do you brush, A 6 months one is just still like a baby. And I'm
Imagine.
thinking, watch I grow up to a year, then
Yes.
at least there'll be 2, then I'll see how I can sort. At 6 months,
Yes.
how do you go around that?
What you should do, take a cotton wool,
Yes.
dip it in water, then squeeze the water out, and then make sure that you're cleaning or you're brushing that tooth all around. Because if you do not do that, and that child is breastfeeding,
Yes.
so at around 3 years, those teeth will be something else. As these teeth comes in, make sure you're brushing. At around 1 year, at least we have several teeth in the mouth.
Yes.
There are toothbrushes for children and toothpaste for children. 0 to 2 years, buy them and do them yourself. Until the child can totally brush their teeth by themselves. We always advise they do it from a supervision point. Yes. So now, if we don't do that, this bacteria that is in the mouth starts affecting the teeth, or rather the gum also. If the teeth are not affected, you can see the gum being affected. And when it's affected, now we have this bad breath. Yes, so that's where bad breath comes from. Although bad breath can also come from, in children, can also come from other infections. Maybe you have some internal infection, from the GIT perspective, from tonsillitis, all that can cause bad breath. But the most one, or the most important one in this case, is the one that comes from lack of good hygiene or improper hygiene.
Okay.
Yes.
I know you're watching, dear parent, and you're wondering, wow, when is the last time I brushed my 6 months old
I know.
their teeth? So if you're in that WhatsApp group, please do something tonight
It's true.
before they go to bed. And if you have any questions regarding your dental health and hygiene in your child or children, please do not hesitate. Our SMS line is 22232. That is 22232. And of course, our specialist, our dental specialist, Ruth Gasheru Mungai, will be glad to answer all your questions. Remember again, 22232. The number is right at the bottom of your screen. So you've talked about bad breath, and as parents, we have agreed from tonight we are brushing,
We're brushing.
their teeth.
Yes.
Another thing that is really common, tooth decay and cavity
Yes.
in children.
Yes.
So where does that start? And I've kept away the sweets, I've kept away the nice things,
Yes.
but still they get cavity.
Yes.
What happens?
From this point of, we didn't do the cleaning the way it's supposed to be done, so these bacteria become active in the mouth. So when this bacteria combines with food particles, it forms what we call a film or an acid that attacks the tooth. So when that structure of the tooth is attacked, now it develops to a dental caries or cavity. So that's what we call dental cavity. Grace, amazingly, this cavity will not pain in the first stage. It will not pain in the second stage. And even in the third stage, it will not pain. But in the third stage, you could feel some sensitivity. But now in the fourth stage, now someone has pain. So what I'm saying is that if you are able to be seeing your dentist at least once or twice in a year, we're able to do checkups. That's why we insist on checkups. So in these checkups, we are able to see now the teeth. If there is this cavity that is forming in your teeth or your child's teeth, we can detect it in the first or second stage.
Yes.
Or the third stage. Before now, it becomes painful, And when it's painful, now imagine seeing a child 2 years or 3 years old having sleepless nights because of toothache.
Painful.
And Grace, toothache is something else.
Yeah.
You know, it's not a pain that you can bear, and you say like, let me just, bear this. It's pain and severe pain. So I'm imagining this child, and I've truly seen. Actually, personally, the reason why I'm so passionate about oral health awareness is because I've seen children 2 years old with gross caries, 3, 4, 5 teeth in the mouth. And I'm wondering, how is this child eating?
Yeah.
Is even this child enjoying life?
Yes.
What's happening to them?
Okay.
And the pain is immense. So what we are saying is that from the point of hygiene,
Yes.
to the point of visiting a dentist is very, very crucial.
Okay.
Yes.
From point of hygiene to
Yes.
visiting a dentist
Yes.
is crucial.
Yes.
I want us to take a quick break. When we come back, I want us to pick it up from there.
Okay.
How often should I bring this baby? How soon should I start?
And how often should
bringing
you
the child
brush?
to bring and how to brush.
Yes.
Keep it right here at Hop TV. Look and Live. This is Health Chick. My name is Grace Mutiso. I'm hosting Ruth Gashero Mungai, a dental specialist, helping us discuss dental health and hygiene in children. Any question on 22232? We'll be right back.